Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. How to prevent cancer. Early screening. Introduction. Cancer is a leading cause of death worldwide. Up to 2/3 of all cancer cases could be prevented if people applied all the cancer prevention measures that we know today. Detecting cancer early can greatly increase your chances of a successful treatment. This patient education module discusses some of the symptoms, risk factors, and screening recommendations for the most common cancers. What is cancer? The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing without normal control, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are rarely life-threatening. If the tumor invades and destroys nearby cells, it is called a malignant tumor or cancer. Cancer may threaten a person's life. Cancerous cells may also spread to different parts of the body through blood vessels and lymph channels. Lymph is a nearly clear fluid produced by the body that drains waste from cells. It travels through vessels and bean-shaped structures called lymph nodes. Cancers in the body are given names depending on where the cancer originates. Cancer that begins in the lungs will always be called a lung cancer, even if it has spread to another place such as the liver, bones, or brain. Although doctors can locate where a cancer begins, the cause of a cancer in a patient cannot usually be identified. Cells contain hereditary or genetic material called chromosomes. This genetic material controls the growth of the cell. Cancer always arises from changes that occur in these genetic materials. When the genetic material in a cell becomes abnormal, it can lose its ability to control its growth. These sudden changes in genetic material can occur for a variety of reasons. This tendency may be inherited from parents. Changes in genetic materials may also occur because of exposure to infections, drugs, tobacco, or other factors. Breast cancer. The signs of breast cancer include a lump in the breast or a puckering, dimpling, or scaling of the breast skin. A bloody or clear discharge from only one nipple may be a symptom of breast cancer, but most discharge, especially if it is from both breasts and occurs when pressure is applied, is normal. Women should be familiar with the normal look and feel of their breasts to spot any changes early. The risk factors of breast cancer include increasing age, history of breast, ovarian, endometrial, or colon cancer before menopause in either you or your mother, sister, or daughter. The risk factors of breast cancer also include abnormal breast biopsy results, first period before age 12 or menopause after age 55, never having children or having your first child after age 30, lengthy exposure to estrogen. Screening may include monthly breast self-exams from age 20, so you are aware of the normal look and feel of your breasts. Regular clinical breast exams. Regular mammograms are recommended to screen for breast cancer. Your healthcare provider will help you decide how often to have a mammogram and when to start. If you have a family history of breast cancer, your physician may want to start mammograms at an earlier age. Remember to get a regular mammogram as often as your healthcare provider recommends. This can help to detect cancers in their early stages. Genetic testing can be done in some women to determine if they carry genes that can put them at increased risk for developing breast or ovarian cancers. If such genes are found, some women decide to have their breasts and ovaries surgically removed to prevent the development of cancer. Colorectal cancer. Digested food gets absorbed in the small intestine. Undigested materials are stored in the colon or large intestine and are then excreted through the rectum and anus. Signs of colorectal cancer include blood in the stool, prolonged diarrhea or constipation, abdominal pain or pressure, or any persistent change in bowel habits. Risk factors of colorectal cancer include personal or family history of colorectal cancer, polyps, inflammatory bowel disease, certain conditions and other diseases such as type 2 diabetes. Suspected risk factors include diet high in fat and low in fiber, physical inactivity, cigarette smoking. Screening for colorectal cancer usually starts at age 50, but it can vary based on your risk factors. Discuss with your healthcare provider at what age you should start and stop screening. Options to screen for colorectal cancer are stool blood test every year, stool DNA test every 1 or 3 years, flexible sigmoidoscopy or virtual colonoscopy every 5 years, colonoscopy every 10 years, or double contrast barium enema every 5 to 10 years. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Endometrial cancer. The endometrium is the lining of the uterus. Pregnancy and the use of birth control pills appear to have a protective effect against endometrial cancer. Signs of endometrial cancer include bleeding between menstrual periods or after menopause. Women should report these signs to their healthcare provider. Estrogen exposure is the main risk factor. Risk factors include first period before age 12, menopause after age 55, estrogen replacement therapy without the use of progestin, never having children, history of infertility. Other risk factors for endometrial cancer include personal history of breast or ovarian cancer, obesity, certain conditions, and other diseases. Remember to get regular pelvic exams if your healthcare provider recommends them. He or she may also recommend other tests if you are at high risk of endometrial cancer. Cervical cancer. The cervix is the opening of the uterus. The signs of cervical cancer include bleeding after having sexual relations or between menstrual periods. Risk factors for cervical cancer include first intercourse at an early age, multiple sex partners, cigarette smoking. Cervical cancer has been linked to human papillomavirus, HPV infections, a sexually transmitted disease. To screen for cervical cancer, your healthcare provider may perform a pap smear test and/or an HPV test. A pap smear test allows the doctor to examine the cervix for precancerous cells. An HPV test looks for the virus that can cause cervical cancer. Vaccines are now available to try to prevent infections with HPV. These vaccines can help prevent cases of cervical cancer. Prostate cancer. The prostate is about the size of a walnut and is located below the bladder and in front of the rectum. In its early stages, prostate cancer may have no signs or symptoms. Signs of prostate cancer may include blood in the semen, difficulty in starting or stopping urination, pelvic discomfort, or bone pain and impotence. These symptoms may result from prostate problems other than cancer, but you should check with your doctor to be sure. Risk factors for prostate cancer include increasing age, family history of prostate cancer, Race. African Americans and Caribbean men with African ancestry have the highest incidence of prostate cancer in the world. African American men are also more likely to die from prostate cancer than white men. A diet high in red meat or high-fat dairy products. Some healthcare providers encourage screening for men over age 50. Others advise men who are at a higher risk for prostate cancer to begin screening at a younger age. Others caution against routine screening. Talk with your healthcare provider about the risks and benefits of screening for prostate cancer. Skin cancer. Skin cancer is a mole that suddenly increases in size, changes color, or becomes ulcerated and bleeds easily. You can check your body for skin cancer by examining your skin for these signs. Less serious skin cancers may look like a pale, wax-like, pearly bump, a red scaly patch, or an ulcerated sore. Risk factors for skin cancer include exposure to ultraviolet radiation, fair complexion. Risk factors for skin cancer also include family history, occupational exposure to coal tar, pitch, creosote, arsenic, or radium. A physician should evaluate any suspicious-looking mole or sore immediately. Remember this ABCD rule when evaluating a mole. A for asymmetry, B for border irregularity, C for color, D for diameter, E for evolving. Asymmetry. If one half of a mole does not match the other, it may be cancerous. Border irregularity. If the edges of a mole are ragged, uneven, or blurred, it may be malignant. Color. If a mole has more than one color or shade, this may also indicate malignancy. Diameter. If a mole is bigger than the size of a pencil eraser, about 6 mm, or has visibly grown, it may be cancerous. Evolving. If a mole looks different from other moles or changes in shape, size, or color, it could be cancerous. Decreasing sun exposure and artificial sun tanning can help reduce your skin cancer risk. Lung cancer. Signs of lung cancer include a persistent cough, coughing up blood, unusual unexplained fatigue, swelling of the neck and face, shortness of breath, repeated pneumonia or bronchitis, loss of appetite and loss of weight, hoarseness, persistent chest, shoulder, or back pain. Smoking is by far the leading cause of lung cancer. People who work with asbestos have a higher risk of getting lung cancer. Not smoking is the best way to prevent lung cancer. If you like this video, please like and share. For similar videos, subscribe to our channel. Testicular cancer. Testicular cancer is the most common cancer in young men between the ages of 15 and 35. Symptoms of testicular cancer include a change in the consistency in the testicles or a small hard lump that is often painless. Men of all ages from 18 on should examine their testicles monthly. Oral cancer. Oral cancer usually occurs in people after 40, but it can occur at any age. The signs of oral cancer include white or velvety red patches, lumps, or hardening of the tissue. You should examine your mouth monthly, particularly if you smoke, chew or dip tobacco, or drink alcohol. Summary. Healthy living habits such as eating well, exercising, not smoking, and avoiding sunburns can help prevent up to 2/3 of cancers. However, sometimes cancer may still occur because of risk factors such as heredity. By learning about the symptoms of cancer and asking for cancer screening tests, you can detect many cancerous growths in their early stages. Thanks to advances in medical science and technology, cancers in their early stages may be successfully treated. The earlier the cancer is discovered, the greater the chances of a successful treatment. Thank you for using Explain.